Solutions, Global Health Solutions. Thank you and welcome to our open clinic on YouTube. Today we're going to talk about the top 5 drinks you should meticulously and intentionally avoid if you are believing God to become a mother, if you are believing God to become a father in 2023. Now, if you're already pregnant and you're counting down to your expected date of delivery, I will also encourage you to avoid these 5 drinks for now. So quickly introduce yourself. My name is Dr. Chidi Ufondu. I'm the convener of this clinic. We meet every Tuesdays, 6:30 p.m., 11:30 p.m. Nigerian time, 6:30 p.m. Eastern time US. And today we're going to talk about the top 5 drinks you should meticulously and carefully avoid so you will have a better chance of becoming a mother, so you will have a better chance of becoming a father. So please, once you come in, let's know who you are. Settle in. Tell us your location. If today is the first day showing up in the clinic, you know we love you. Please make sure you subscribe. Make sure you check your notification button so they will notify you every time I come live. My clinics are on Tuesdays and Saturdays. Tuesdays, 11:30 p.m. Nigerian time, 6:30 p.m. Eastern time, US. On Saturdays, we normally come early, 12 p.m. Eastern time and 5 p.m. Nigerian time. But let's get to business of what we are here to do today. We're talking about drinks. And, you know, when we talk about drinks, sometimes it's a tough topic to broach. But here's the deal. When we are ready to become parents, we have to make do with modifications. So there are a couple of things we no longer need. And remember, for you to be a parent, you have to have actually started modeling parenting. So you don't need to wait till you become a father. You don't need to wait till you become a mother to start adopting healthy lifestyle. The problem with what enters our body, whatever enters your body can make or mar you, can help or harm you. Now, if you have the intentions of becoming a mother, especially, there are some drinks you do not have any business with. Number 1 on this list, alcohol of any shape or form. Alcohol. Now, I know it's difficult for some people to do this because some of us have become accustomed to alcohol. You know, we get our highs, we get our kicks, they are best friend. So it's difficult to tell someone that used to gulp alcohol every day to stop drinking alcohol. Now, I'm not going to tell you to stop drinking alcohol cold turkey, but gradually understand that if you are intending to be a mother in 2023, if you are intending to be a father in 2023, you have to taper off, possibly stop it completely. Now, when we talk about milk, there are so many people that have mixed up a couple of things about milk. When you are consuming your milk as a mother-to-be, as a father-to-be, please, in as much as we want you to make sure you have a healthy body weight, be mindful of the contents of the milk you are consuming. Your milk should be full milk, no low-fat milk, full-fat content milk. I'm going to explain further when I go into details. So remember, no alcohol. Avoid all those half-fat, no-fat milk. You need the fats in the milk. Now, all sodas, all forms of sodas, avoid them. Now, high-calorie content caffeine drinks. For some reasons, the research on caffeine is neither here or there. But if you have to be extra precautious, please be mindful when you're consuming your coffee and other caffeinated drinks. Now, energy drinks, you don't have any business with this no longer. There are so many people that run on Red Bull. There are so many people that run on so many energy drinks. You know, oh, this is what's going to help me to do 24-hour shift and all that. Be mindful. Now, Choosing the right food and the right drink when you're planning to have a baby can receive a lot of attention, and for good reason. Knowing the type of beverages, the type of drinks, the type of food that will help you to maximize your fertility is important. Now, some people will be asking, what about, is soda okay? Can I give up on my coffee? What about my green tea? What about a little glass of wine? And lately, if you're from Nigeria, what about Zobo? Where do we classify all this? What can I do to get the best out of the drink that go into my body? Which drink should I avoid completely? Now, for some people, it will be very difficult to skip your coffee. It will be very, very difficult for you to skip your soda. But guess what? You have to understand that we are on a mission to become parents, and nothing can stop you. Once you are in the mood of becoming a parent, you have to go all the way out to do every single thing you will do to put yourself in a good place. So that thought of occasional glass of wine, if you don't drink wine now, the world is not going to come to an end. So as a parent in wait, we are always willing to do whatever we need to do to get pregnant and give birth to a healthy baby. Now, the problem about drinks, you can become pregnant, but some of these drinks can affect your pregnancy and by default affect your baby. For example, alcohol. Alcohol is a no-no. If you are someone that got up a lot of alcohol and you have a lot of alcohol in your system, your baby can actually have what we call fetal alcohol syndrome. So avoid alcohol by all means possible. Now let's start with soda. Why are we worried about skipping soda when you're planning to become pregnant? The reason is because majority of the contents in that soda you are drinking is unhealthy. Even if you don't want to have a baby, drinking soda regularly is not a good habit. Now, soda, it's made up of so many sugar sweetened components. There is a particular component in soda we call high fructose corn. High fructose corn is a corn syrup. This is not healthy in any shape or form. When you consume all this soda, it will definitely flip your normal body mechanism. There's the way your body is meant to handle sugar. When you begin to binge and consume all this soda, it's going to alter your glucose insulin balance. And when this happens, unfortunately, you might be predisposed to having hormone imbalance. Now, some women that have polycystic ovarian syndrome, the hallmark of polycystic ovarian syndrome is the fact that you are not producing the required female hormones that will help you to ovulate. You are producing more male-dominated hormones that will stop ovulation from happening. Now, women that have polycystic ovarian syndrome, majority of them, we place them on insulin-related drugs. Because when you have infertility, when you have hormone imbalance, it's going to affect the totality of you. So majority of women that might have polycystic ovarian syndrome, we can place them on anti-diabetic drug. For example, metformin. Why are we giving you that metformin? Because when you have insulin problem, when you begin to expose yourself to things that will alter your hormones, you might also have problem with handling sugar. So when you take this soda over time, it begins to contribute to insulin resistance. Ordinarily, the insulin in your body is supposed to help in driving the sugar into the cells, making sure you don't have any peripheral sugar in your blood, which can cause a lot of problems. But when you begin to have problems in the production and action of insulin, you begin to predispose yourself to a lot of problems. So starting from today, number one drink to avoid is what? Soda. Please, you can do this. No matter the quantity you take. Matter of fact, consuming as little as 1 sugar sweetened soda per day is associated with 25% reduction in ability to get pregnant in each cycle. So think about that, 25%. So we can make do without soda. So bottom line, think about kicking your soda habit. Think about replacing your soda with other drinks like water. Water is a very good drink. Water is a very good replacement. You can flavor your water with 0 calorie and you won't even know you're drinking water. So do away with all those soda. Very, very important. Number 2, let's talk about our milk content. You see, because you probably added a lot of body weight, so many people will give you so many advice. Oh, take half fat milk, take no fat milk, take skim milk, take this, take that. But guess what? If you want to be a mother, if you want to get pregnant, if you want to be a father, you need your full fat milk. You need the full component. The reason is because those fats in the milk, they aid in the normal production of your important hormones. So from research, we noticed that women that consume low-fat milk might likely have some problems in regards to how the body handles estrogen. Estrogen is predominantly a female hormone that makes you to ovulate and do all that. Now, when you begin to take milk without full component of fat, it can actually flip your estrogen-androgen balance. Men have more androgens, more testosterone. Women have more estrogen. Now, when you don't have enough estrogen, your body will flip. So you begin to produce more testosterone, you begin to produce more male hormones, and you begin to have characteristics of a man, which can cause infertility. So please, for intentions of pregnancy, consume full milk, full fat milk. Now, when you're drinking milk, of course, you have to be mindful now. You're not supposed to be drinking it as if milk will no longer exist. So in as much as I will encourage you to drink your full fat milk, because it contains a lot of things. Apart from the fat, it contains vitamin D, it contains calcium that will help your body to perform optimally. When you begin to consume all those low-fat milk, it can disrupt your reproductive system. It can affect your ovulation. It can affect your ability to conceive, especially women that might be predisposed to having polycystic ovarian syndrome. So please, drink your milk, full milk. It's okay to do this. It's helpful. Now, be mindful when you're drinking it, okay? So, milk, it's encouraged. Avoid low-fat milk or no-fat milk. Low and no. No means you do not have any fat. That's not good. You still need your fat, but you need to be careful. Okay, now number 3 drink we have to be mindful about is what? Caffeine. There are so many things we consume every day that contain caffeine. Number 1 is our coffee. There are some people that can't function if they haven't taken their morning joe. Now, my people, it's neither here or there. Now, what I'm going to tell you is something that has been researched. Now, in as much as we have not had a clear-cut, defined relationship between coffee and fertility directly, please be mindful of the calories. Be mindful of the quantity of caffeine in it. If you ask me personally, reduce it as best as you can. Now, regular coffee, based on definition, just regular coffee without putting your sugar, your whipped cream, your caramel, and all that. For some reasons, from researches we've conducted, it appears not to affect your fertility if you limit your drinking to 2 to 3 cups per day from research. So for many, it's not the caffeine in the coffee that keeps them addicted. It might be the flavor. Now, for some people, it might be the coffee. So, but the question is, where do you draw the line? Now, for fertility purposes, in as much as of today, we do not have a clear-cut association between coffee and fertility. What we know, it has a dose relationship kind of process. So the more coffee you consume, the more it can disrupt a lot of things in your body. So in as much as, based on what the science says and the researcher says, I can't tell you, hey, don't drink coffee completely. But be mindful. We are talking about the outcome. Now, relationship of coffee and caffeine regarding fertility can come in 2 ways. We can look at it from women that are already receiving fertility treatment or women that are naturally planning to become pregnant. Fortunately, we don't have any negative relationship. But we know that women that are already pregnant, when they consume a lot of coffee, they have a greater risk of having miscarriage for some reasons. So drinking coffee, especially in a higher dose, it's been correlated to 37% increase in having miscarriage. This is according to American College of Obstetrics and Gynecology. The recommendation is to limit your coffee to less than 20 milligrams per day. I'm talking about women that are already pregnant. Personally, I will tell you to avoid it completely. So your coffee is another thing. Your caffeine, there are some beverages that contain caffeine. There are some energy drinks that contain caffeine. There are some drugs that contain caffeine. There are some painkillers that contain caffeine. So be very conscious when you're taking them, because they might indirectly play a role, if not in your fertility, but in the inability for you to carry your pregnancy to term and be called a mother. So bottom line, moderate your coffee intake to less than 200 milligrams per day, or completely avoid it if you can. If you are looking for a way to cut your caffeine in your coffee, you can make it just, half, or you can make it plain without putting all those whipped cream and all those sugar and all that. Whichever way, be sure that you know the effect of coffee even when you become pregnant. So personally, I will tell all pregnant women to avoid coffee for now. Now, when we talk about alcohol, this is an area we normally want to encourage ourselves and find a way to say, oh, but they said that little alcohol can be good to health and all that. Guess what? For women and men that want to become pregnant and have babies, you don't have any business with alcohol. There is no quantity of alcohol that has any positive things to do in your body regarding your fertility. Matter of fact, alcohol can affect the male fertility. It can affect the production of the sperm, and alcohol can also have a direct effect on the eggs. So avoid it. There is no way to shape it. There is no amount of alcohol that is considered safe while you're trying to become pregnant. So you have to avoid it completely, including your palm wine, including a couple of all those ones they encourage you to drink. They tell you, oh, drink this, drink stout, drink this. There's no problem with that. Avoid alcohol completely. You don't need it completely. Now, alcohol can also lead to poor outcome when you're going for assisted reproductive technique. So if you're going for IVF, if you consume a lot of alcohol, the possibility that the IVF will fail is very high. So avoid your alcohol by any means possible. You don't need it completely. Okay? Now, when we talk about alcohol, we have to also talk about energy drinks. That's the last one I'm going to talk about. You see, in this era of wanting to be up 24 hours, wanting to know what's going on in social media, then going to work the following day. So there are some people that won't sleep in the night. Then in the morning, they will pop a lot of Red Bull and all those stimulants so they can be up and make a living. Guess what? Energy drinks, it's not good for anybody that wants to be a mother. You don't need energy drinks. Do you know why? It contains a lot of sugar. It contains a lot of caffeine. Then it also contains a lot of stimulants, which can disrupt your whole normal body mechanisms. So energy drinks is a no-no. So let me summarize. Avoid your alcohol, any form of alcohol. Avoid your energy drinks. Be very mindful when you're consuming your caffeine. Avoid your low-fat milk. Go for full-fat milk. These are evidence-based drinks you should avoid. When you do this, together with avoiding stress, together with eating good food, together with making love regularly, together with going to a fertility specialist, you will become pregnant faster compared to people that just do this. Because the opposite of what I'm telling you now, if you begin to consume all these drinks I'm telling you about, the possibility your body weight won't be in a good range is very high. And when your BMI is high, what happens to your fertility? Your fertility will drop. So by default, if you can avoid all the drinks I've mentioned, I'm going to recap, then you are more likely going to be in a better position to be a mother in 2023. So avoid alcohol by any means possible. Avoid low-fat milk. Avoid soda. Avoid high-calorie caffeine drinks. Then finally, avoid your energy drinks. Okay? That's my presentation this evening. Right now, I'm going to open the clinic so you have opportunity to ask your questions. So please go ahead and ask your questions in real time. After this clinic, immediately after this clinic, we're going to transition to Facebook, to our page, and we'll repeat this topic. So don't miss this opportunity. The reason why we are doing this is to create more audience, because some of our members are not in our YouTube, but they're out there in Facebook. So anytime we have a very helpful topic, we want to give the opportunity to a lot of people to benefit. But right now, the clinic is open. Please go ahead and ask your questions. Start asking your question. Okay, COO, you're already asking, what about air quality? Do these drinks affect air quality? 100%. Alcohol can affect egg quality. Excessive caffeine can affect egg quality. Sodas can affect egg quality. Any single thing, quality of the eggs. For example, when you begin to consume a lot of low-fat milk and you begin to have lack of estrogen, estrogen is a powerful female hormone. When you don't have enough estrogen in your body, you cannot ovulate. Why? Because estrogen works with FSH and LH to go for negative feedback in the brain. So when your body senses that you have low estrogen, what will your body do? Your body will increase the production of FSH. When your body increases the production of your FSH, you are no longer going to be liable to having a hormone that will go and get you ready to become pregnant. So anytime estrogen is down, the likelihood that FSH will go up, and anytime FSH goes up, it might correlate with low fertility. We always want the estrogen to be within normal range. And unfortunately, as you're getting older, your estrogen will be reducing anyway. So imagine by age, your estrogen is already reducing. Then you're exposing yourself to all these soda, you're exposing yourself to low-fat milk, and you are further reducing your chance of having your natural estrogen that will help you to become pregnant. Okay? All right. Please keep asking your questions. We have about 10 more minutes to go. All right, let's see. And if a woman is already pregnant, should they avoid these drinks also? 100%. Please avoid your alcohol. Be mindful of the caffeine. Personally, I know the recommendation is to reduce below 200 milligrams per day. But personally, as a pregnant woman, because we have 37% likelihood of having miscarriage, avoid the caffeine completely. Avoid the low-fat milk and all those dairy products. Avoid your Zobo. I didn't mention Zobo. Zobo is a hibiscus drink. For now, we don't really know where to classify that Zobo drink. So we are better off avoiding it. Definitely avoid your energy drinks. Anything that can alter anything in your body, avoid them. So the answer is yes. What is applicable to women that are believing for baby is also applicable to pregnant women. You don't want anything that will affect your chances of being called a mother, okay? Now, remember, some babies might be born with what we call fetal alcohol syndrome. So if the mother is a heavy alcohol drinker and the father is a heavy alcohol drinker, by the time both of them come together, when the mother is contributing her egg and the father is contributing the sperm, they can have problems. They can pass it on to the baby they will have. Because remember, the mother will bring 23, the father will bring 23. They will combine and have a 46 set of chromosomes. So you can breed alcohol-damaged sperm, and you can bring alcohol-damaged eggs, and they can form together to lead to what we call fetal alcohol syndrome. So you can give birth to your baby as an alcoholic. That's not a fair thing to happen to any baby. Okay? Tosi, what's your question today? How about the caffeinated coffee? So you see this concept of caffeinated and decaffeinated. Let me tell you the truth. They are the same thing. Just like diet soda and normal soda, they are the same thing. Personally, from my experience. So I know they will say decaffeinated. Who do we ask? How do we know? How do we know how decaffeinated our coffee is? And how do we know how this is? So just play safe. Avoid them. You see, we grow every day by what we do every day. So things that become a habit are things you learn over time. It doesn't happen overnight. So you can learn how to unlearn those practices. So the normal belief is, oh, if you don't drink coffee, you're not going to function in a day. No. If you used to stay up late night, then go to bed early so you can function properly. Just like growing up. When we were growing up, they used to say, oh, if you smoke in the morning, you can open your bowel easily. So many young men started smoking, and if you ask them, they will tell you, oh, because if I open my bowel, if I smoke, I can easily open my bowel in the morning. It's not true. It's a conditioned behavior. So avoid every single iota of coffee in that quantity, whether it says it's decaffeinated or it's not decaffeinated, there is coffee somewhere there. Okay? I love that question. Please, what are the exact examples of type of infection that hinder success of IVF? The two infections I want you to be conversant with regarding your fertility and poor outcome, chlamydia and gonorrhea. But guess what? anytime you're getting ready to go for any procedure or even getting ready to be pregnant, we are going to screen you for all the sexually transmitted infections. So there's a particular screening. You're going to go for syphilis, you're going to go for herpes and all those other infections, including HIV. So we have to make sure you don't have any of this, because they might not stop you from becoming pregnant, but when you become pregnant, they can affect your baby. Okay, but the two ones that can affect your fertility directly by leading to PID, pelvic inflammatory disease, that can damage your tube, chlamydia and gonorrhea. Of course, if you're going for IVF, we would have checked all these infection screen, would have made sure that you don't have any problems. Anybody going for IVF would have made sure that your body is perfect. You don't have anything that will stop you from having a positive outcome. A good IVF specialist can do this. Okay, so it's important you have this conversation with your IVF specialist. And we have those facilities in our community. We can refer you, and our IVF providers, amazing people, they will be very transparent. They will give you your report. They will explain everything to you. So if you have that option, you can come and run with us. Okay. It seems like water is the way to go. Before, Uncle, this is water. Water is life. Today, if you notice, I didn't flavor my water. Previously, I used to put 0-calorie flavor, so you will see me drinking it, you'll think I'm drinking juice. You can't go wrong with water. Water is the best fluid, both for before, both for within and after pregnancy. You can never go wrong with water. So drink your water. So COO, yes. It seems like water is the way to go, but water is boring. Any tips to enjoy your water? Flavor your water. I'm personally not a water drinker, but since I discovered a 0-calorie, something you can put in your water and your water is just pretty good, then I started drinking water like fish. So go to that supermarket, check any of the flavors, but make sure it's 0-calorie. Put in your water and drink it like, your juice. It will just taste exactly the same thing. If you do that, you're saving a lot of money and you're living healthy. So think about flavor. Flavor is good. Okay, guys, we have 3 more minutes. 3 more minutes, then we are done for today. Please ask your questions and begin to transition to our Facebook page. Shortly after this, I'm going to go to the Facebook page. Then we're going to interact. Then after that, we're going to have a break. So please, if you miss this particular clinic because you are not in our YouTube, make sure you follow this group in YouTube. Make sure you subscribe. Make sure you set your notification to tell you when I come live. 5 p.m. Nigerian time on Saturdays, 12 p.m. Eastern time, US. Then on Tuesdays like today, 6:30 p.m. Eastern time, 11:30 p.m. Nigerian time. Once you show up, you will see me every Tuesdays and every Saturdays. You can't go wrong with it. Okay, guys, 2 more minutes. 2 more minutes. Let's round up. Now, remember that on the 31st of this month, we have a very big event, an event you don't want to miss. You will have regrets if you miss this event. We have a gynecological disorder masterclass. We are going to talk about all the important gynecological issues, especially gynecological pathologies like fibroid, like endometriosis, like adenomyosis, like your polyps, like your ovarian cyst, hormone imbalance, UV prolapse. We are going to talk all about them. Now, when you have any of these conditions I mentioned, if it's not properly handled, it can affect your fertility, it can affect your pregnancy. And I don't want any woman that will say, oh, because I have fibroid, I can't become a mother. That's not true. Even with your fibroid, if you deal with your fibroid the right way, you can have your baby. Even with your endometriosis, depending on the management, depending on the stage of diagnosis, you can still go ahead and have your baby. So there is no truth that once you have this, you cannot be a mother. Every woman out there can be a mother. So I encourage you to register for this event. It's going to be on the 31st, 9 p.m. Nigerian time. Make sure you invite your partner, and we'll see you when we get there. What causes infection in infants? This is a broad spectrum question, not to see. It can be anything. It can be viral. It can be bacterial. Like you have your malaria infection. It can be caused by female Anopheles mosquito putting the Plasmodium falciparum, which is the malaria parasite in the body of the baby. So there are so many things that can cause infection in the baby. Now, be careful. Infections are top killers of babies. Your malaria can kill your baby before you blink. You can have bacterial infection that can cause pneumonia. You can have viral infection that can be overwhelming. So any infection out there, any bacterial infection, any fungal infection, any viral infection, any parasitic infection can affect the baby and can have a very poor outcome. So if you suspect that your baby is having infection, don't stay back and be giving that baby antibiotics by yourself. There are some people that will give birth to their baby within 1 week. They will begin to pump the baby with all sorts of drugs. Don't do that to your baby. Take your baby to a neonatologist. A neonatologist is a special pediatrician that specializes on new babies. That's the person you should take your babies to, okay? All right. My time is up. Thank you for coming. I look forward to seeing you guys again on Saturday. Until I see you, remember to subscribe. Remember to click on the notification. Remember to watch other important videos. We have so many amazing videos that can change your life. Once you find this community, everything you need is provided you by the grace of God. Now remember, if everything else fails, God will not fail you. And if you continue to practice your prayer, if you continue to make love 48 hourly, and if you continue to have someone that will be there with you to walk the whole length, which is practicing, which is getting a fertility specialist, before you blink, you're going to be a mother. Thank you for coming this evening. I will see you guys right away in our Facebook page right now, okay? Thank you so much, COO. Thank you, Tosin. Thank you, Adeze, and I think Itoya. Those are the guys that came to the clinic this evening. So I'll see you guys in Facebook right away, okay? Thank you and bye-bye.